If you're trying to conceive and feeling overwhelmed with fertility advice, then this podcast is for you. Welcome to Don't Tell Me to Relax, your fertility podcast and antidote to unhelpful fertility information. I'm Hannah, a fertility acupuncturist, teacher and campaigner for better fertility education. This podcast aims to empower and inform you about your menstrual cycle and fertility. It's basically all that information you didn't get in sex ed at school, with the aim of improving your understanding of your reproductive health and optimizing your fertility. Hello everybody and welcome to this episode of Don't Tell Me to Relax. This episode is all about exercise and I am joined with the lovely Hollie from the Bump Plan.
Hi.
Thanks for joining us. And the reason that I asked Hollie to come and speak with us, and the reason that I think this is a really important topic, is because what we see in clinic so frequently is confusion and concern around exercise and how to exercise and what kind of exercise you should be doing when you're trying to conceive. And I feel like there's a lot of fear about it, and to the point where people actually stop doing anything at all because they don't know what to do. And so they kind of take the line of, right, I'm not going to do anything, or I'm just going to do some gentle walking. And that often really annoys people because they previously really enjoyed exercise and got a lot out of it. So before we delve into that topic, Hollie, would you like to introduce yourself and say a little bit about what you do and what your background is, please?
Sure. Yeah. So my name's Hollie. I have a toddler who is nearly 4 and a 12-week-old baby at the moment. And I'm the founder of the Bump Plan. I started off as a Pilates instructor about 11 years ago. So when the fitness industry was very, very different. And over the last 11 years, have then qualified as a postnatal fitness specialist and personal trainer. And basically gone down the route of wanting to support women in staying active at all stages of their lives.
Yeah.
But completely kind of anti-aesthetic. So my absolute bugbear is how the fitness industry has been taken over by, well, you can't hear the word exercise and weight loss or exercise and sexy bum, without in the same sentence. And we're the complete opposite of that. We try and help women understand that exercise is nothing to do with aesthetics. It's all about health and looking after yourself for life. So that's kind of my main mission. And the Bump Plan has grown massively over the last few years into a Trying To Conceive fitness plan, which obviously you were involved in, a pregnancy plan and a postnatal plan. And I've got a book out in June this year as well, all about staying active throughout the whole Trying To Conceive pregnancy and postnatal journey.
Amazing. So you are well placed to help us kind of look at this problem and sort of pick some threads out of it and give some good bits of information for people, because I think it's the confusion around exercise that is concerning. And I know there is difference around exercise when you're trying to get pregnant and exercise when you're trying to get pregnant with IVF. So can you just give us a background as to where this kind of confusion and this fear has come from around exercise when you're trying to get pregnant?
Yeah, so I think what's really important, if it's okay with you, is to start off discussing kind of what exercise and physical activity really is.
Yeah.
Because that will then help when it comes to talk about guidelines in a moment.
Yeah.
So first of all, let's talk about the definition of exercise and the language that we use. So I'm going to be talking mainly about physical activity today. I'll try not to use the word exercise too much. Because when we think about exercise, what we're really talking about usually is kind of like a structured form of moving our body. So we think of things like going to the gym, doing a Pilates class, moving our bodies for a specific purpose, whether that's getting fitter, losing weight, what have you. When we talk about sports, we're talking about a movement of our body that's usually bound by rules and is quite competitive and is occasionally kind of a group situation. Whereas when we talk about physical activity, what we're talking about is literally just moving our bodies. It's anything that gets your heart rate up, that gets you a little bit breathy, a little bit sweaty, and it can be absolutely anything. So it could be gardening, it could be having sex, it could still be Pilates or going to the gym, it could be playing football. So when we talk about physical activity, we're talking about any form of movement. And so actually it's really inclusive. It's much easier to meet physical activity guidelines because we can make it up from anything. We don't need childcare necessarily. We don't need money necessarily, and we don't need teammates. So we talk about physical activity. So that's the first thing to just quickly touch on. And then what we have in the UK at the moment is we have official guidelines when it comes to physical activity, which is really helpful. And these guidelines I always point people towards because these were created by the chief medical officers of the UK, and they're based on lots and lots of research. And so they're not anecdotal. I'm not an influencer saying, oh, here's what I did when I was trying to conceive and it worked for me. These are based on the evidence that's out there. So when we talk about the chief medical officer's guidelines for physical activity, what we have are guidelines that have been created for different populations. And most of us will fit into just the general adult population. And what we found with increased levels of physical activity is there's lots of health benefits, reduced risk of cardiovascular disease, reduced risk of certain cancers, improved mental health. And so the guidelines for the general adult population are that really what we should aim for each week is to do at least 150 minutes of moderate intensity physical activity. And I'll touch on intensity levels in a minute. So 150 minutes of moderate intensity physical activity to include strengthening activities at least twice a week. So that's anything that's going to boost musculoskeletal strength. So that might be body weight exercises, it might be lifting weights, it might be carrying shopping, and that we try and reduce our sedentary time. So actually, when we look at that, 150 minutes of any form of movement, and moderate intensity just means that it gets your heart rate up, but you could still have a conversation. So actually, when we look at those guidelines, lots of us are actually probably meeting that anyway, doing things like, commuting, walking to the train station, gardening, having sex, things like that. And so those guidelines apply to the general population, right?
Yeah.
So hopefully lots of us are doing that. And then all of a sudden we might start trying to conceive, and we think it's going to happen overnight because of what we're taught by children. And then maybe things aren't quite happening as quickly as you thought they would, or you already know that there's an issue and you're going down the fertility treatment route. And then obviously, you then start questioning everything that you do.
Yeah.
And that's where these common myths start to creep in of what you should do, what you shouldn't do. And physical activity is one of those ones, as you've already mentioned, that does really creep in and becomes a bit of an earworm for lots of people trying to conceive. So sorry, I've kind of gone off on a tangent there, but I think it's really important to understand some of the terminology there and what the general population is supposed to be doing.
Yeah.
Where it becomes an issue is that we have guidelines for the general adult population, which I've just explained.
Yeah.
And then the guidelines for anyone kind of who is on this path of trying to become a parent then the guidelines then go straight over to pregnant people. And so then the guidelines, if you're pregnant, are that you take part in at least 150 minutes of moderate intensity physical activity. And so really similar to the adult population. Something I didn't mention though with the adult population is with regards to the cardiovascular side of things, we're aiming for 150 minutes of moderate intensity physical activity. So wordy. But it can also be that you did 75 minutes of vigorous activity. So you might do something that's like spinning, where your heart rate is really, really high. And so you don't have to do as much cardio.
Yeah.
Once you're pregnant, though, we want you to stick at moderate intensity. So again, it's 150 minutes of moderate intensity physical activity per week, 2 times muscle strengthening a week, and essentially not being too sedentary. So they're really similar to the general adult population. But there's no kind of bridging. There's no official guidelines for those who are trying to conceive. So what you end up with when you're trying to conceive is you kind of have to choose between one of those guidelines.
Right.
And you either have to decide, I'm going to train as if I'm just general adult population, not trying to conceive, or I'm going to train like someone who's pregnant in case there is an overlap here and I do happen to be pregnant at some point and not know. And so I think that leaves a real grey area where clinical professionals aren't sure what to advise, and it is slightly left down to the individual.
Yeah. And it's interesting, isn't it? Because from what I understand and reports that I've read, there is always this idea that, people who exercise, it does improve your chances for conception. People who exercise get pregnant quicker, according to studies that I've seen. But so that sounds like, oh, great. Okay. But I guess it's like, what do, there's not it within that study, there's not a lot of guidance as to what do we mean by exercise, and how much should you be doing, and when should you be doing, and what intensity should you be doing. And that is then the confusion, isn't it? And so people just stop, or they
Exactly.
don't do it, or they don't do what they previously did. And then that, I always think, well, then that has a negative impact, because if you're not doing what you love and that stresses you out, then you're kind of in that whole cycle already of feeling kind of resentful or worked up that your life is being restricted by, what some by doing something that could be actually really helpful for you.
Yeah, definitely. And that's why it's so important that there are guidelines
Yeah.
for every population, because what we don't want is this massive drop off. We
Yeah.
know there's a huge drop off of people who are active whilst they're pregnant. We know that when you're pregnant, staying active has huge benefits, the same as when you're not pregnant, but then also pregnancy specific benefits. But the Active Pregnancy Foundation, they did a survey and they found that I think it was 75% of pregnant women were not physically active. They didn't meet the
Wow.
guidelines, which is huge. Yeah.
Wow, gosh.
And so I think where there is probably a bit of a drop off, and what we hear a lot of at the bump plan is that, while people are trying to conceive, they stop exercising for whatever reason, which we'll touch on in a minute. And then they get pregnant, and then obviously they're so nervous that they might do something wrong,
Yeah.
or harm themselves or their babies, or they're worried, well, I've not exercised for 6 months, 12
Yes.
months, 2 years whilst I've been trying to get pregnant, so I better not start exercising now.
Yeah.
And then that's a really long time to be inactive, and we know that there are health issues there. So you touched on kind of the research side of things, and I think that's the biggest reason why there aren't official guidelines at the moment.
Yeah.
Because the studies that are out there are really conflicting and varied. And so it makes it really difficult to create general guidelines because they are so specific. But if we actually look at the research that's out there, and we kind of generalize, which is all we can really do at the moment, what the research tends to show is that those who are active, before we go into this, let's just quickly touch on intensity again, because we talked a minute ago about moderate intensity, right?
Yeah.
When we're talking about physical activity, so moving your body, we can almost think of like a scale of 1 to 10 of how hard we're working. So let's say one out of 10 is you sat on the sofa watching the Bake Off, right? You're doing nothing, really low level. Then 10 is you like near the end of a marathon. It's like the hardest you could possibly work. You couldn't do it for much longer. You're absolutely on your ass. So then we've got no intensity as number 1, and we've got very, very vigorous intensity as number 10. Moderate intensity would sit kind of like a 6 or a 7. So you're doing it, you could chat to your mate, you'd sound quite out of breath, but you'd be able to have a conversation. That's moderate intensity. And then we would think about vigorous intensity would go up to kind of like 9, and then very vigorous would be 10, right?
Yeah.
So there's an intensity element to moving our body. And then there's also frequency side of things, like how often we're doing this. Is it once a week, twice a week, 3 times a week? And so when we look at the research, what it tends to show is that people who take part in kind of moderate level physical activity around those guidelines do tend to have an increased chance of a reduced time to spontaneous pregnancy, and an increased chance of live birth. So there are definite benefits to moving our bodies. Where it then gets a bit confusing, and I guess where the grey area has come in, is that there are some studies that have shown that those who take part in very high intensity physical activity, or very frequent, so people who are doing like 4 hours or more a week, are at increased risk of things like subfertility and infertility, and ovulation issues. But actually, when we really break that down, is that not slightly common sense? Because we see that in high-level athletes. They're putting their bodies through huge demand. Understandably, it's their job, and so I guess the research is kind of showing that too much of a good thing can be harmful.
Yeah.
And so, yeah, I think that's where it becomes tricky. So
Yeah.
actually, the research tends to suggest if you're just doing the guidelines, moderate intensity, 150 minutes a week, you're not going crazy with it.
Yeah.
Then you're probably actually benefiting your
Yeah.
fertility and your
Yeah.
fertility treatment outcomes if you're going through IVF. But too much
Yeah.
might be detrimental.
And that's what I always say to people in clinic is that, you know, it's too much where, you know, if you know your cycle, and this is why I always talk about menstrual cycles as like your blueprint, because if it's too much, then it will show on your cycle. So you will either start having problems around ovulation. So your ovulation won't be regular. You might miss an ovulation, or you might notice that your period's becoming lighter. You know, it's impacting your estrogen levels. And so you can look at a menstrual cycle and look at it and see, is this a fertile cycle? And if it's changing or if it's going off in some way, and you know that you're, you know, really hitting it with the exercise, then I always say, well, okay, try and bring the exercise down. And does that have an impact on your cycle? Because you can see it. And I always think, well, is that where the fear comes from? Is this kind of like high level activity? Is the actual issue is that high level activity is impacting the menstrual cycle. And that is where this idea of it being a barrier to fertility is coming from.
100%. I think it's that. So it's probably that someone has taken those studies that were, some of these studies were into high level athletes.
Yeah.
And so they've kind of taken those results and then extrapolated them to mean, well, it must mean that staying active is not good for you when you're trying to conceive, whereas actually it's not necessarily that. It's that it was high intensity, high frequency. And I think it's possibly also an overshoot from when bed rest used to be advised for people who are going through IVF, you know, that kind of like that underlying insinuation that doing nothing right now is probably a good idea for you. And that also goes into pregnancy, you know, because we've treated women who are pregnant, you know, like they're very fragile and they're so precious and delicate, whereas actually the research shows that moving your body during pregnancy is so much better for you than doing nothing. So I think it's just been, a culmination of misinformation and the fact that there aren't official guidelines to fall back on at the moment.
I think when they did the first IVF, didn't the women have to stay in bed for the whole time when they were going through their treatment?
Yeah, I think there was a study that I saw and it was like 1980 and it was talking about bed rest, you know, so it's like that long ago, but we know more now that bed rest during IVF is detrimental to your health. And I think a lot of that they think is down to kind of the psychological effects, which you've touched on as well. You know, if you're an active person and physical activity is a big part of your identity, it's part of your weekly schedule. For me, it's how I maintain my mental health. I know my mental health slips if I don't move my body. And so all of a sudden, if that's taken away from you, as well as having to track your cycle, you know, thinking that, well, I mustn't drink too much alcohol, you know, timing sex, it's already, trying to conceive is already such a, am I allowed to swear?
Yes, you are.
It's such a head fuck anyway, that then to take away that coping mechanism for lots of people is really detrimental to their mental and their physical health. So I think we just need to be aware that it's not just about our physical health. It's understandable for someone who's trying to conceive or who's going through fertility treatment to want the best possible outcome. I get that 100%. And to be concerned, well, you know what, if there is even a risk that physical activity might make this take longer, I'm going to stop doing it. I completely get that. But I do think that we need to remember that there is an effect on our mental health. And so maybe staying active would be really beneficial right now. And also the fact that if we're successful and we do get pregnant, we need to be strong to get through that pregnancy. Pregnancy is hard on the body. And so, I think we need to really look at all the different areas that physical activity affects and not just stop it because one GP said, maybe just stop running.
Yeah. And that's
such a flippant comment, but it can really be an earworm.
Yeah, it really is, because once a health professional, a consultant or a GP has said that to you, it's a very difficult place, isn't it? Because then you're carrying that kind of like, oh, well, if I do this, if I exercise or if I carry on running, then that could be the reason that I am not conceiving or that my treatment isn't working. And that is, it's not, it cannot be as black and white as that, because, you know, as we've just discussed in this, there's lots of grey areas, and there's so many grey areas in fertility. When someone is struggling to conceive, actually getting answers, why is it not happening, or why is it not working? It's very, very rare for people to get answers, or one answer. It's often a combination of a number of different factors, and having that, holding that on you, like I've done something, my run or my HIT class is the reason, is just so unnecessary and such a burden, I think. And it's often the women who carry it. I mean, I know there's a lot of stuff around men and exercising, but all of this stuff seems to be placed at the door of women trying to conceive, and there's a lot less at the door of men trying to conceive. So yeah, I think it's important to really be clear on why someone said that, and you know, what some good guidelines are, so you're not carrying any sort of fear or shame around what you're doing.
And lots of people are getting lots of different information, and I think it's because you know, fertility, you know, let's say you go to your GP to talk about fertility issues, you know, they are not experts in everything. They're not supposed to be experts in everything. So if you say to them, am I allowed to still run? Can I still do yoga? Chances are that they might not know the answer. They might not have read all of the research, because that's not their job. You know, it's not their job to know the answer to absolutely everything. And so sometimes they might err on the side of caution and say, you know what, yeah, maybe just, you know, if you're a big runner, give up running. Also, it's important to understand that one person's version of I do a lot of running and another person's version of I do a lot of running are very different. And that's one of the issues with some of the studies into physical activity and fertility, is that they were often using self-reported measures. So they were asking people, you know, like how intensely do you exercise? And again, you know, my version of intense exercise compared to somebody else's might be very different. So I would just say that it's not, it's so hard to say this without sounding like a dick, but, you know, asking a GP, just quickly mentioning, you know, am I okay to keep running? I wouldn't necessarily, and you get an answer, I wouldn't necessarily use that as your only source of advice. I would do some research around that. Don't just suddenly stop exercising because one person mentioned very flippantly, maybe give up running.
And do you in the and you know, when you talk to people on your course, do you vary the exercise according to where people are in their cycle? So do you have like advice for that run up to ovulation? Because lots of people, you know, I put out a poll on Instagram and in the Facebook group, and lots of people were like, should I be doing vigorous exercise when I'm in the 2-week wait? And so when I'm talking about the 2-week wait in this context, we're talking about people who are trying naturally, who are not going through IVF. And that was a big thing. You know, do I need to change up my exercise because of where I am in my cycle? And what do you think about that?
So what we basically, when we created the Bump Plan TTC, there was nothing else out there like that, and I still don't think there is at the moment. Again, mainly because you know, if maybe people don't necessarily want to put themselves out there and say this is what I advise, whereas we worked with lots of professionals and we worked with lots of experts and we did lots of research, and we worked with the Active Pregnancy Foundation as well to kind of work out, you know, people who are trying to conceive, if they want to stay active, let's at least support them. And you know, they're not children, you know, we'll give them the information and then they can make a decision for themselves. So what we sort of decided was, let's then use the guidelines for pregnancy, so moderate intensity levels for the cardio, for the workouts, but explain that you know, we don't know that there is a reason why you can't do more vigorous exercise, but here is what the research says. And so to err on the side of caution, do moderate intensity, because that still gives you all the health benefits that you're getting from physical activity: reduced cardiovascular disease, reduced risk of cancers. And you don't need to then worry if you are that way inclined that you are doing too much. So throughout the TTC plan, what we are giving you is the perfect combination, the guidelines, the official guidelines: 150 minutes, moderate intensity, physical activity, muscle strengthening exercises. And we're giving you everything, all the tools that you need for if you're successful and you go into pregnancy. So
Yeah.
educating you on your pelvic floor, how to strengthen your core.
Yeah.
So we don't change it based on where they are in their cycle, but
Yeah.
instead there's lots of options with the exercises. So it's more about how you're feeling at that time, and what feels moderate intensity at one part of your cycle will feel different to another part of your cycle. But as long as you're aiming for that moderate intensity,
Yeah.
and you know what that is,
Yeah.
then you can vary it as you go through.
So weights, because quite a few people asked about like weights and like sit-ups and things like that in a 2-week wait is absolutely fine.
I mean, I don't know I do know where some of this comes from. So I get lots of questions like, can I do twisting exercises? Can I do crunches?
Yeah.
Okay. Again, it's where there's this kind of like crossing over of information from all different populations and times of this journey, right?
Yeah.
So I think sometimes where the question about things like inversions and like twisting and things like that, I personally think that comes from the concept of not the concept, the issue of ovarian torsion.
Yeah.
Which really comes into play in fertility treatment.
Yeah.
So it's where the ovaries have become a risk factor is that the ovaries are enlarged because of fertility treatment, and they can twist, and the ligaments that support the ovary can twist, and it can stop blood circulation to the ovary, which can damage it. And it's more likely if you're going through IVF, but it's still a very, very rare but very serious issue. And so you'll find the advice, if you're going through that form of treatment, would be things like, maybe not doing inversions, not changing direction quickly, but lots of high impact, bouncy exercises. How accurate that is, I don't know, but I guess it's erring on the side of caution, right?
Yeah.
So, but that's for a very specific type of IVF or stage of IVF. So, but then somehow that's trickled down into the 2-week wait. The fact that we're getting asked, just when people are just trying naturally to get pregnant, that so that essentially what I'm saying is it's like there's no reason for that whatsoever. Like your body is still just carrying on as a normal. So no, things like sit-ups, even when you're pregnant, sit-ups and things, you don't really need to consider getting rid of those until much later in your pregnancy. See, I don't know if I've actually answered your question, but I heard the sit-up one, and I can't tell you how many times I've heard people saying like, can I do like oblique rotations and things like that? And I'm thinking, where's that come from? And the only thing I can think is that ovarian torsion risk.
Yeah. And I think that is really, really helpful, because I think it really unpicks why there is that fear. And you're completely right, is that there is a reason in, if you've had IVF and you're in that 2-week wait and your ovaries are kind of swollen and you're feeling bloated, that you might want to avoid that. But that is a very different experience to when you're trying to conceive naturally and your body is in a normal natural cycle and your ovaries are doing what your ovaries are supposed to do. And that is not a problem of changing. You don't need to change your exercise at all in that period, unless you want to, because you're feeling more tired, because you've got more progesterone than estrogen. And so, there is that idea of working with your cycle depending on how your hormones are making you feel. But that's just more from a feeling perspective as opposed to an actual physical reason why we wouldn't do a Russian twist at that point.
Yeah, exactly. Yeah.
And in the guide, do you do specifics for IVF? And is there anything that you do adapt for people who are going through IVF?
So again, where it's very difficult is that it really depends on why someone's going through IVF.
Yeah.
And if there are any health considerations that might be why they're going through IVF. And so what we have to do is at the screening, at the initial screening, which we have for all of the bump plan plans, we have a really in-depth screening that we've created the Active Pregnancy Foundation again, to make sure that we are not stopping people from exercising who we really want to, but we're also being mindful of the fact that, we don't want to encourage somebody to do something when they should have spoken to their GP. So in the screening, if they answer that they're going through IVF, we do ask that they speak to their IVF specialist and explain what the bump plan is,
Yeah.
and ask them. And it's, it's a shame because we've heard of IVF specialists potentially using outdated advice,
Yeah.
and I get it, they want the best possible outcome as well. And so they want to err on the side of caution too. But sadly, it's one of those things where I can't be the person to tell somebody whether they're safe or not. It does need to
Yeah.
be their IVF specialist.
Yeah.
And then if their IVF specialist says, yes, I want you, you can take part in moderate intensity physical activity, fantastic. Then they can do the bump plan TTC,
Yeah.
knowing that it is moderate intensity. It is in
Yeah.
line with those guidelines and the
Yeah.
guidelines that they would have if they then were to have a successful pregnancy.
Yeah. Yeah. And that is, again, that is really great, isn't it? Because it's just having that sort of knowledge, and okay, this is the sort of guideline or the framework within which I can exercise, and I'm not going to worry about it, because there's nothing worse than doing something and having that voice at the back of your mind that's saying, oh, this could be detrimental. So what you're providing is, these are the guidelines, this is the science. If you exercise within this, there can only be benefits. And then you're shutting off, because there is enough of that kind of self-sabotage, difficult conversations that go in your brain when you're going through treatment. So just having to be able to shut that bit off and say, okay, I'm going to do this, I'm going to enjoy it, I know this is really benefiting me, is such an amazing place to be when there's so many other things to think about and so many other grey areas. So it's really helpful, isn't it, that people have got that?
Yeah, I hope so. And I mean, obviously, things happen, you can't account for absolutely every possible eventuality, but I think it's just knowing that the plan was based on the evidence that's out there at the moment, and was created with experts. It just gives you, that feeling of kind of having your hand held a little bit.
Yeah.
And that also, I think there has to be an element of positivity as well. And obviously it's very easy for me to sit here and say this because I've not gone through fertility treatment. So I don't sit here pretending to be an expert on this at all. But,
Yeah.
I think that exercising whilst trying to conceive, knowing that what you're doing right now is also going to benefit you if you do end up being pregnant, is also a really positive way to think about it as well, especially because for women, we're taught, as I mentioned at the beginning, so from such a young age, that exercise is actually a vehicle for weight loss, which I absolutely hate, because then it's already such a negative association. I need to exercise to look like J-Lo. If people, I don't know, J-Lo, it shows my age here. There's probably somebody nowadays that everyone's wanting to look like, or that I need to lose weight, or, we heard our mums, doing Jane Fonda because she wanted to drop a dress size, what have you. And so I think anything that you can do to associate physical activity or exercise with something that's more positive is really beneficial. And so I really think when you're trying to conceive, however that looks for you, thinking about exercise or physical activity as being something that's really going to help you go through the future, whatever your journey is going forwards, I just think is really positive, and can move you away from that whole diet culture message.
Yeah. And also doing it in a framework where you're moving away from those messages, but you're doing it without the fear or the confusion or the kind of terror that this is actually going to be detrimental. Because I think, the positives of exercise are just endless, aren't they? They're endless. And I always talk about, going through fertility struggles is stressful. It's so stressful. So I'm always like, okay, and you can't get rid of that stress. There's, everyone, it's why our Facebook group and why this is called Don't Tell Me to Relax, because all those unhealthy, you can't relax. There is just no way. It is stressful, and that is the bottom line. And I always say it's looking for the things in life that are like the antidote for that stress. So acknowledging that the stress is the stress, it's not going to go away, but what can you do that kind of balances that out? And exercise is a really big one, because it's free. There's many ways you can do it without paying money, and it's accessible in various different forms to everybody. So what a wonderful thing, and what a shame it's been shrouded in, fear.
Yeah, that's exactly the right word, fear. And how awful to feel, to do something that feels so good, but be in the back of your mind terrified that you're being selfish or that it's going to be detrimental, when actually you don't need to.
Yeah, absolutely. Thank you very much, Holly. So if people want to find out about the TTC on the bump plan, I can put all the information in the show notes. I don't know why, but I always like saying that.
Sounds very snazzy.
What's your website?
Thebumplan.com.
Bump plan. Okay,
yes, yeah.
Lovely. Well, thank you very, very much for taking the time to come and speak to me. It has been really, really helpful. I know this is going to be such a popular episode for people, because I think what you have given is a really clear explanation as to why there is the confusion and what we can do about it. So that is an amazing thing. So thank you.
You're welcome. I hope so. And yeah, I think that it's just realizing that there are so many physical and mental health benefits to staying active. It doesn't always have to look like you know, training for a marathon. It can be going out for a walk, doing the housework. I mean, that's boring, but you know, it's still physical activity.
Yeah.
And you know, and it needs to be whatever makes you happy. So remember, I think the key takeaway here is that physical activity takes many forms, so you might as well enjoy it. I hope that it helps get you through whatever you're going through at home.
Oh, thank you. Lovely to speak to you, and thanks for your time.
Thanks, Hannah. Bye.
If you've enjoyed listening to this and want to find out more, then come and join my free community in Facebook. We have loads of resources. You can catch up on all our previous webinars and be the first to know about forthcoming events. To sign up, just follow the link in the show notes. And if you'd like to work one-to-one with myself or one of the team, then please see our website, hannahpern.com, where you can book in directly or organise a discovery call to find out how we can support your fertility and your reproductive health.